everybody, and welcome back to another episode of The Male Perspective. I am your host, Lana Reid, and today on this day, I am so tickled, so pleased that I have the opportunity to sit down with a gentleman by the name of Eloy Vazquez. He is a provider recruiter at MetroHealth System out in Cleveland, Ohio. Looking forward to speaking with him today and learning about what he does in the medical world. But first and foremost, sir, I take this quick moment to pause, say thank you to you for making time for me today. Time is a gift. Once we give it, we cannot get it back. So I truly appreciate you setting aside this time in your day to sit down and chat with me. And with that, sir, welcome.
It's my pleasure.
Thank you. And also, let me say a quick thank you to our sister Patty over at Ultimate Connections for setting everything up today. Without her, couldn't have happened. So thank you to her real quick. And let me go ahead and jump in on you, sir, because I have a little amount of time with you today, and I'm going to pack a whole bunch of stuff in. So let's get going on what you do in the medical world. A lot of people might not be familiar with the term provider recruiter. So as we get started, could you explain to us what it is that you do to make sure us common folk have exceptional care?
Well, for one, I'd just like to say thank you for having me. It's a pleasure to meet you and have an opportunity to speak to you today. Provider recruitment is really an interesting space. People actually think it's just recruiting and it's under HR. We operate in a different space because of certain things that we do in the timeline in order to hire a provider. It's best that we have that removed from HR into its own entity, which is provider recruitment. So I'm responsible for hiring doctors, researchers, pharmacists, nurse practitioners, and physician assistants. Okay. And I absolutely love my job. I work for a safety net hospital system in Cleveland, Ohio. That's where I'm born and raised. And we take care of every patient, regardless of their ability to pay, whether they're insured or insured. And I've always had an affinity for the underdog. At one point in time in my life, I was the lead recruiter at the Board of Education in Cleveland, Ohio. At that time, it was the Cleveland Municipal School District under the leadership of Dr. Barbara Burt-Bennett, who's one of my biggest inspirations. And she taught me the reason as to why. You have to find out what your why is in life. And when you find that passionate about it, as I read about you and your background, passionate about what you do, it doesn't feel like work. It feels like a mission. It feels like you're accomplishing something. And that's what I did at the Board of Education, diversifying the workforce, hiring teachers. And I'm blessed to say that's what I'm doing at the MetroHealth Schools hospital system. So day in, day out, I work on processes not only to recruit, but also retention. And reason for that is because I look and view that my boss are the 400,000 patients. I know who my CEO is. She's a dynamic woman, Dr. Erica Steed. She recently just started in December this past year, and she is a phenomenal trailblazer. So I know who my boss is, but my real boss are the 400,000 patients that rely on me to find the very best providers to take care of them and treat them with the most utmost respect and really help them get all what they deserve in life. So importantly, healthy lives. So.
A servant, truly a servant. That is, we don't have enough of that in this world, especially in today's climate. It's, me, mine, and what I can get. But we really are put on this earth as human beings to serve each other. And your gift will make way for you. So, it's nice to get the paycheck too as well. But, it's also nice to have that fundamental foundation layer of serving. Now, I want to ask you, because I heard you mention who you're responsible for recruiting. Are the other staff members in the facility, like, your x-ray techs and your lab tech, does that fall under your umbrella as well, or no?
That actually falls under HR. So, so how we view it is the providers limited to advanced practice nurse practitioners, physician assistants, PhDs, medical doctors in that capacity. Nurses, unfortunately, still go on their HR. Pharmacists are coming over to us.
Okay.
And the reason being of that separation is a credentialing process. And that correlates with your privileges in order to prescribe, but most importantly, so it has to be limited in that capacity. Nurses can prescribe only on the behalf of the doctor. The doctor actually signs off.
Okay, so, got you. Okay, got you. So for the potential candidate that you have before you, are you looking for the top-notch school and graduated top of the class, or are there other requirements or credentials or qualifications that you're looking for that makes a prime candidate for you to hire?
Excellent question. Actually, I look for all of the above and more. Okay. So it doesn't always have to be a person who graduated from Harvard, trained in Yale, and no, because typically those individuals, although they are very talented, might be disconnected with the population I'm responsible for. Mm-hmm. I look for those who are mission driven, to be honest with you. There's a reason why you became and decided to invest so much of your education and finances into medicine. And I'm looking for those who got in it for the right reason, not their reasons, but the right reasons, that they want to take care of the patients. They want to have their landmark as being, I want to help others. Mm-hmm. Because I was blessed with the ability to retain information, blessed with the ability to heal, and I want to share that with those who I think I can make the greatest impact. So yes, I always look for the check in the box, where you went, where you trained, but I also look for the intangibles. Where did you train in residencies and fellowships? If it had nothing to do with certain acclimated environments that I'm responsible for, then it's a concerning factor for me. Can you relate? Okay. And the reason I'm saying this is important. Historically speaking, the Black and brown community has always been not only marginalized, but also used as guinea pigs when it came to medicine over the years. Mm-hmm. So there's a lot of distrust. Mm-hmm. And I need those who can understand that you have to be able to bridge that gap. Just because you're the provider doesn't mean that they're going to bring down that wall. Mm-hmm. They already feel defense, and they also already feel like you're not going to do what's right for me. Mm-hmm. The population we have at the MetroHealth medical system is the fact that a lot of them have these roadblocks. Some of them do not trust them as a provider, don't think that they're going to have the best treatment, and think that all you want to do is just charge them a huge bill, give them some medicine that is supposed to help them, but not explain. They're not making establish a relationship. So when I'm interviewing providers, I want to know, how can they relate? Gotcha. And how would you bridge that gap with someone who, now pose that question, that has been felt like they have not been heard when it comes to providers. Okay. In the past, that they haven't taken the time. Okay. Other medical schools, other medical systems, keep saying that, other medical systems surrounding, like a Cleveland Clinic or UH, all phenomenal. But more of them, they actually spend as little amount of time because that's not what they're trying to do. They're a burn and churn. Okay. Our providers are given a lot of flexibility to bridge that gap and spend time with them, whether it's the medical assistants, the nurses, the nurse practitioners, the doctors, the physician assistants. We're given that time because it's a partnership. Okay. And we know that we have to establish that relationship early on, because I can treat you, but if you don't believe what I'm doing, it's going to help you. Okay. It will just spin our wheels. Okay, gotcha. So going back to your question, it is important for me to be very thorough, to find those who really understand. And you'll be surprised. Unfortunately, in this medical day and age, it's a lot of people, especially in this capacity of being doctors, they don't even take the time to even do research on the hospital system. it is that blatant obvious. They're not trained to understand that. They think that because they have a piece of paper that says, I'm a doctor, that you should be privileged to have me in front of you. I tell them, you're just like everybody else. And I say to, and I never call my recruits by doctor. I do that intentionally because I don't think if you're more concerned with me calling you doctor, then you're definitely not the right provider for me. Yeah. And I'm not saying that. I'm just saying because I don't know if you relate to my patients. Over the 1,000 CEOs that I am responsible for. I don't want them to feel like because you're a doctor that they can't talk to you or you're going to talk down to them.
Yeah, you can't establish a relationship and a connection.
And establish them. And that's concerning for us.
Now, I'm hearing you say a couple of things that I just want to take a moment to unpack here. And I'm not really sure if you can answer my question, hopefully so. But it's been a long time since I've been to Cleveland. I'm assuming from hearing you talk that it is a predominantly Black and brown community. And it makes me think of a time when Serena Williams, she had her daughter, she was very vocal in saying that she didn't feel like as a Black woman, her needs were being addressed in the hospital when she was giving birth to her daughter, she was overlooked by the medical staff. Here we are in 2023, and we're still, as Black and brown communities, having these struggles with the medical facility, which you've laid out. What proactive steps are some places taking to kind of render care that's more empathetic and understanding to our needs? When you unpack all of this stuff, we have distrust, a lot of times where we're saying we're in pain and it's being discounted and stuff like that. Are healthcare systems kind of training staff or no, or?
So, yeah, and thank you for that question. That is something very apparent in medicine, has it been in the past, also in the present. And you would think, and thanks for reminding me about Serena, someone who is a star, a global phenom, and still treated as if she's less than with the respect that any human should have. So, and that's where the importance of we having those conversations with these providers that we're recruiting and hiring.
Okay.
We have an onboarding process to definitely make sure they understand our population. Okay. But most importantly, beginning in the interview process is that I really want them to take time to research who we are. I would stop an interview and tell them, let's reschedule. And they'll ask why. I said, I took the time to read your CV to get an understanding where you trained, where you're from, what's your hobbies, what you like, your fellowship, what are your scores.
Okay. That
means I was vested in you. But unfortunately, it seemed like you know very little about my medical system. So I tell them, I say, it's not your fault, it's your training. And I said, I did it. Let's just start new, let's reschedule, let's give me the opportunity. I want you to make an informed decision because we're making an informed decision about you. So not to say it was a bad first impression, I just want to give you a chance to make the right impression. And it's unfortunate. Part of our responsibility is what we're trying to do is create partnerships with local medical systems, colleges, medical schools, and actually go even further, partnerships with STEM schools as being the major focus. And we're really trying to help encourage those in various backgrounds, whether they're persons of color, if they have the high affinity. We want them to get exposed. I'm blessed to say MetroHealth has its own high school. This focus around STEM. Yes, it's something that right now is a partnership with the Cleveland Metropolitan School District. When I was there, it was called, as I mentioned, from municipal. But we have a partnership. We're the first that we're aware of any hospital system that has their own affiliation with a K through 12. And we have 11th and 12th graders on campus with us.
Awesome.
And the reason why we're doing that is because we want to find those who have a high affinity and interest of STEM and introducing them to what those STEM interests can actually translate to.
Okay.
So I know I'm unpacking a lot of things, going back to your original question. So there's a lot of things that we try to make sure that we do early on in our process. With our nurse practitioners, we have a year-long training for them. And the reason being is not saying that they're not capable of doing their job.
Mm-hmm.
But what we want to do is make sure that we prepare them with the necessary skill sets, because they don't have a fellowship, an opportunity with other, or a residency that other doctors have. This is their fellowship.
Okay.
And it's paid for them. And it gives them the confidence, the skills, the resources necessary. Not only that, because we hired them because they have the affinity. They know who our patients are. They want, we need them to be here. That's the difference. We will invest with them. And we will take that year long to make sure that we carry them along the way, because we want them not only to be here, we want them to retire here. And we want them to establish this relationship with this patient, because of a lifelong process. So I know I gave a lot to you, but
no. I mean, I love learning. So, and hopefully the audience will get a lot of takeaways from it as well. So any information you have to pour into me, I'm like a sponge. I'm going to soak it up. And I just kind of lost my thought here. Yeah. So with MetroHealth System being situated in Cleveland, listening to you talk, is the staff ratio reflective of the demographic that it serves, or no?
I like this. You're good. So no, honestly, it's not. So our patient population, you're looking at more than 68%. I had to report this to the board. And our providers are, and that's Black and brown, okay? Meaning, of course, African-American, Latino, and those further descents. Our providers are majority Caucasian. Now, I would say this, just because they're Caucasian doesn't mean that they're not reaching. And we have some phenomenal providers. Caucasian, African-American, Latino, Hispanic, Asian, phenomenal. And they get it. They get it. But they also too agree with the mission that we want our community to be reflected in the providers. And that's what I work hard to do, to make sure that we're able to bridge that gap. I'm proud to say that within the 5 years of time I've been working in this space, we actually beat the national average as far as recruitment of Black and brown providers year after year after year.
Okay.
And we're getting there. We're still a long way, but we understand that. And our CEO, Dr. Erica Steed, she is, as I mentioned before, she wants us to get it done, and she demands results. And work once a quarter. I have to report out along with my director, and we talk about the steps that we're doing and how we can actually accomplish it, where we are and where we plan to be.
Okay.
We can understand that if we're able to show that, then not only the community will embrace us more, because we're embracing them. When they see that, they see more of those that look like them. Most important for me is that when I'm able to bring that person of color who's a provider, just think about the impact it's going to make for that little child that comes in.
Yes.
That's a game-changing opportunity.
Yes.
Because so many times when I check back and follow up with my providers, they say, this child was staring at me, and I hear them whispering, she looks like me. And that really feels me. I'm like, who would have ever thought? Now that child is looking and saying, I can do that. Did we just change a course of what someone's life? I love it. So
yeah. And you listen to our kids, so many of them say, when I grow up, I want to be a doctor. And, here it is, you have the system in place, you have the school system connected to the hospital. It seems like an opportunity for more of these dreams to become a reality. But somewhere in the transition, we have all of our kids saying they want to be a doctor, but it doesn't pan out for a lot of us, and we don't end up seeing many of us that look like us in hospital facilities. But Mr. Vasquez to the rescue. Dun, 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 dun. We're going to change that.
We're, we're going to do our best. We're going to do our best. There's a lot of things that we need to do. We really need to start having these medical schools to diversify their faculty.
Okay. I hear you. Okay.
If you look at a lot of these medical schools, the faces that are along the walls, these professors, them. And you see a lot of the struggle. That's one of the things that we're trying to work extremely hard to bring enough influence when we partner, is to talk with these major programs, regardless of what they are, and say, well, how are you actually embracing diversity, equity, and inclusion?
Okay.
We have a whole department. It is a department in MetroHealth.
Okay.
And that's why I always share. The other medical systems might see diversity in February and celebrate it. We do it 365 days out of the year. And we press that. When we talk to various medical colleges, we ask them, how's your matriculation, not just your acceptance of the application, the matriculation across for persons of color. And if it's low, we want to know why. And then we're starting to find out that there is a gap. There's some kind of barrier, because the assimilation of cultures. We have certain some brown persons of brown and black that are very, very well off and influentially influenced. Then you also have those who struggle and don't have the money. It's expensive just to apply to medical school. That application alone is over $100 each. And to get into medical school, you're applying to anywhere from 10 to 20 schools just to get acceptance into one or multiples and increase your chance. That's a huge amount of debt.
Yes. Just to get in.
Just to get in. And then the debt that you have to absorb once you get into medical school. My son, he's an electrical engineer. He graduated this past December. He was thought about going to medical school, but the one thing he took back, he says, none of the providers, the professors look like me. He said, the amount of debt I'll have to assume, he says, why would I do that?
Yeah.
You have a young Black Latino who is an electrical engineer, got swooped up by a phenomenal company, and treating him and exposing him to all the thrills and privileges of life. And he said, I'll never consider medical school. He said, because my debt's going to be paid off in a relative short amount of time. The average debt that these colleges and these medical students come out of is almost $500,000. Yeah, $500,000. Yeah, I'm sorry.
No. But so what are some fixes we have? Because just speaking about men of color, we can get you guys into college, but then the problem is getting you guys to graduate. That's an issue. But if we want to accumulate more of that, actually pursue medical degrees so we can have our end product where we have more representation in these facilities, how do we, you're talking about finances here. We're talking about having staff that's culturally connecting to us so that we can, how do we start to fix this system?
Great question. So we start to fix it is to eliminate a lot of the profitability of these colleges. Okay. First of all, just college alone is just the rate that the tuition has increased year after year after year after year is alarming. We need to hold more ownership back to these colleges and universities that are accepting state and federal funds, that if you accept a person and they complete with a degree, that degree should equate to a job.
Yes. Okay.
But so many are taking on degrees that's not translating to anything that is going to ascertain anything that's going to help them
Mhm.
One, survive, two, pay off debt and have any kind of stability.
Mhm.
So I think the whole educational system has to be revamped. No college and university, especially receiving state and federal government,
Yeah.
should ever monetize and use that as an influence in order to keep someone in debt.
Mhm.
For one, personally, I believe education should never, in the state schools should never be. Um, it should be free for everyone who pays taxes. For one.
Yeah.
But that's a different topic and a different story, and that's not what you're asking. As far as getting more, I think we have to start early. We need to expose these kids, these young kids, these brilliant, beautiful minds early in elementary school and find out what they love. If they have a higher affinity with mathematics, let's enrich them further.
Mhm.
That's what's so important about the STEMs. Make the translation into what they love to do, into their passion, if they know what it translates as a future for them. If we're able to bridge that, and maybe that will get them. We show them that this, if you have a capacity for this, XYZ, you can become a biomedical engineer because you love mathematics and you just formulate, or even sciences. You love science. But do you know how important it is for you to understand science and become a doctor or a researcher? You know, some of these times it's so hard for them to make that kind of bridge. You know, they're so young, but let's make it fun for them. And how that actually is a rewarding opportunity for them when they start seeing that they're not only they have a high affinity and talent and an aptitude for it, let's expose them to what it can translate to.
Mhm.
You know, I love the movie. I'm sorry, it's escaping me. Hidden Figures. Love it. I love that movie so much. And I see how that young, beautiful child, brilliant in mathematics, got into working for NASA, being a computer. But she was so brilliant with it because it was not just a job. She loved numbers. She
Yes.
understood it. It was like her life.
Yes.
And like, you see how that one child just translated and advanced to this where she was and the impact she made, saving lives, you know, and improving a space program, Black woman, you know, those kind of connections, let them see early in life. You love mathematics, talk about them.
Mhm.
You know, you want to be a scientist, Eric Morgan, show him what he's accomplished. You know, if we make those connections, not only they see it, they believe it, and they can be it.
Yeah.
You know, so let's start them early. Let's make those connections early on. Let's arm them with the resources early in advance and show them what that career path. If we're able to do that, then we can find better ways to help finance it early on. There's so many scholarships that none of these kids are exposed to.
Wow.
You know, you'd be surprised how many things they can actually get, either locally or nationally,
Wow.
year after year after year. And I know this because I just had my son just graduated. My daughter had one more year in semester for her for graphic design. We learned so late the kind of scholarships is just if you just apply, you look for something. If you're Latino and you're a woman, and just say why you're going to school,
Oh, wow.
they'll give you $5,000. Insane, $5,000.
That's
But none of us are exposed to that.
Yeah, it's all about exposure, and you talking about when, especially when it comes to our kids, a lot of time they're not even exposed to the career options that they have. Sometimes it's, they're only funneled into one or two options, and that's not a sustainable model sometimes. But it's all about exposure, and sometimes as Black and brown children, they're always pigeonholed sometimes into these specific areas. So um, that's it. Well, you know what? Let me circle back here because I want to get back to what you do. Because
Okay,
I
I'm
feel
sorry.
no, because I feel like we could talk for a while on a lot of stuff, but I want to I want to make sure I unpack what you do as a provider recruiter here. And then at another time we can come back and talk about some other stuff. Um, your job as your career as a provider recruiter, if you have a potential candidate in front of you, what would you advise them to do as they're looking around, as they're interviewing with you, to properly vet you and the facility to say, hey, this is someplace I feel like I want to work. This is a fit for me. what would you advise that candidate to look for?
I ask them, I always advise a candidate, and I tell them this is a two-way street when you're interviewing. We're interviewing you, you're also interviewing us. And I always tell them there's no such thing as a dumb question, only dumb questions one that asked. And the reason why I say that is because it goes back to my emphasis, not just recruitment, it's retention. If I find you, I want you to make an informed decision because this is a life-changing opportunity.
Okay.
And what I mean by that is that because, especially those who just coming out from medical school, your first decision actually sets the solid foundation of your career as a launchpad.
Okay.
So I asked them, what are you passionate about? And what got you into medicine? And what you want to do? And if they tell me, I said, great, I'm gonna get you connected with all these other faculty members. And it's just like what we're doing right now. It's just a series of conversations.
Okay.
And it's great dialogue. Okay, we started off as Zoom. And then if there's interest mutual on both ends, we bring them so they can actually not only they hear about the mission, they can breathe the mission, okay? And they can live the mission. We want them to be submerged in it. And we make sure that we have them connected with the right people and a like for like. Okay. So say if I have a young African-American male physician coming on board, okay, not only would I get him introduced to the other faculty, but I'll connect him with a one-on-one. I want to provide that resource so he can ask that someone that looks just like him in the mirror. Ask him, why did you choose Metro?
Okay.
I mean, you have Cleveland Clinic over here down the street. You have University Hospitals over here. Why did you choose Metro? Okay. And that's on because they're mission driven. This population, okay, I care about. Or they say, you know what, I feel like home. And that's what I tell them. If you feel like home, you're not going to want to walk away from home. Mm-hmm. You know, and that's where our process is a lot different. I connect them with the chairs of the department. And I tell them, I said, one thing you will find is different. I said, if I'm connecting you with the chair, that means you're not only very important, but your time is as well. So is ours. Okay. But I'm giving you an opportunity that you might not get at the Cleveland Clinic, UH, Akron, or wherever. You might not even ever see the chair in your interview. Okay. But I'm gonna connect you with a person, you can ask them. And then what I love the most about our process, I want them to share what they see as their vision in their practice. And if it makes sense for us, how can we marry it together? So it's a give or take process. I win, I lose, you know? But the most important thing is I want them to make an informed decision because I'm proud to say over 75% of the people I hire are still here.
Great. You know, yeah, because the medical industry, burnout and turnover is really real in that industry. So to say that the majority of your staff stay around and stick around, that's commendable. And then also it says to the relationship building potential possibilities that you have, because it's nothing more endearing than to have a situation where a mother brings her child back, and this used to be my doctor when I was this age, and now this is your doctor. I mean, it just creates a very committed feeling to the community situation. So it's a beautiful scenario and setup. So I think I have a couple more questions because I've taken up your 30 minutes. So just be patient with me.
No, I'm here. I'm all yours.
Just be patient with me. So if a young person, because we've been talking about young people and careers and stuff like that, but let me flip it a little bit. If somebody is watching this, a young person is watching this and says, you know, I want to be like Mr. Vazquez when I grow up. What steps do they have to take to become a provider or recruiter?
Great question. Let me see. So I actually, to be honest with you, I stumbled into this. As you saw in my my resume, I did medical research early on, then I got into sales. I just love people. I do. I love talking to people. I love getting to understand and know people. And I try to build, relationships with people. I generally care about them. Whether they care about me or not.
I'm gonna love on you anyways.
Yeah. I'm gonna love you, and you have nothing. You can't do anything about it. So, but that's always been my affinity, and I always remember something about somebody. Okay, but I don't forget them. If I see them, you know, I really want the best for them. A little story. So when I became the lead recruiter of the Board of Education, helped transform, you know, once again, trying to bring in more Black and brown to reflect. Even then, the majority was Caucasian as well, and still great teachers, you know, regardless. I hired on through an alternative process to help diversify, and paid for their masters in this alternative licensing process, and they've done now. Years later, because obviously I transitioned from Board of Education to sales, I run into them, and they'll tell me, Eloy, like, hey, you know, I'm trying to remember that. They're like, you don't remember me, do you? I'm like, I think I do. They say, you hired me. I'm like, oh, wow. So, well, what you doing now? He says, I'm a principal. The high school I was telling you about in MetroHealth, I hired her as the principal of that. She first time I saw her, because I didn't get a chance when I first came on board to go check it out. She saw me just passing, and she calls me out, and she says, oh my God, I've been telling everyone about you, how you changed my life.
Oh.
And I'm looking at her like, get out of here. Where? She says, here. I'm like, here? She was like, yeah, I'm the principal in Lincoln. I was like, oh my God, you are? She was like, yeah. She was like, you remember the day that you told me you're not just, I ran into you and you said, you're hiring teachers, you should think about it. She says, you hired me on. She says, and I stuck it out, and now I'm a principal, and you changed my life.
Oh, awesome.
And those are things that I love the most. And I'm not saying I'm in it for that, but I love to see people thrive. We've got to go more. She just, I mean, I brought her in this program. She is doing phenomenal things in Cleveland. She's a trailblazer.
Awesome.
And just giving people those opportunities.
Yes, gave her her first step.
Yeah. And yeah, it really is. It's something. I don't even know if I answered your question.
No, but that, you know, to be able
I love
to
it. You're
impact
like, oh,
impact people's lives, and you know, I mean, you just never know what role you are playing in somebody's path and somebody's journey. And we're all here, we're all connected, and I think a lot of times a lot of people are missing that key element, that we're all pieces in this puzzle. You know what I'm saying? We're all pieces in this puzzle. So, and his face is still reflecting like that was just a phenomenal thing.
Yeah, it is. If I think to the original premise of how we can actually get more into medicine, if we remember each one of us, regardless of where we are, how we struggle. It's difficult for us to pay for school, study for an MCAT, pass that science or OCAN, write my essays for or interview. If each one of us, regardless of our vocations, but in this case in medicine, remember how we struggle to get and make it, we need to reach back.
Yes.
And if we all just find one person,
yes,
one person that we're going to say, I got you. I'm going to be your mentor. You're not going to struggle. I'm going to help you every step of the way because I know you want to become a provider. I see a passion in you, but you just need a little guidance, and I'm going to invest my time into you.
Yes.
If we all do that, then you can imagine how the impact and the growth and the opportunity for us to transform how medicine is today, but also how it is taken and is approached to take care of the marginalized, to diversify, to help minimize the amount of debt, to make education more accessible across the board.
Yeah.
I think if each of us, if we say we made it, what is going to be the harm?
Mm-hmm.
I think that's the onus, because there's a lot of people before us who struggled so that we can even get this far.
Yes.
I know it's kind of, I don't know, quirky to say, but I think that truly, if we really want to make a difference and impact and transform and change things, it's not going to be coming from politics.
That's true. That's true.
The only one who's going to get it done is us.
That's true.
So we got to say, am I going to,
That's true.
if we can do it.
That's what, these are my elders behind me. And I always tell everybody, I said, the only thing that I want is for them to be looking down at me and saying, you know, that particular child, she understood the assignment, you know, we can say, you know, well done, child, well done. You know, there was so many before us that paid a price, and who are we to just negate what they went through so we could be here doing what we're doing? We're supposed to pay that forward. So, and on a large scale, I get the impression that many of us think that we've arrived. There's no struggle anymore, but you know, we're sadly mistaken. So
Yeah. So ending, just buttoning your question, to become a provider recruiter, you just got to have a passion for people.
Okay.
Just stick with the mission. If you really want to hire good providers, then ask your question is this: I like people. I want to hire providers. What would be my focus? Well, when you interview this person, put your child in front of you. Do you think that person would take care of your child? Treat your child with respect, with dignity, okay? Not judge, okay? Not talk down to, but have a vested interest in that person's health and growth. Okay, then continue the conversation. That would be my best advice for someone. College education, I have a master's and a bachelor's, almost 2 bachelors. Patty and I both were supposed to get our bachelor's in Black, African American history. Cleveland State didn't have it at that time, but proud to say, and Patty, I know she wants me to give you 10, but I'm gonna give her a shout out. She and I both, coursework that we did for our associate's degree is what helped make it pass to become a actual degree for the state.
Awesome.
Yeah. So I don't have to do 10, Patty.
Okay.
No.
I'm gonna ask you one more question before I ask you my random question.
Sure.
And that's just because you mentioned sales, and salespeople are very intriguing creatures to me. I tend to be one of those people where I give you my pitch and you say no. I'm like, oh, okay, and I'm packing up my stuff and I'm moving on. But salespeople are very persistent individuals. In your years of sales, being a top seller, just getting it, just hitting the mark, do you think that is like an innate skill, or somebody can learn that?
I think somebody can learn it.
Oh, so you can teach me, because I'm really like, oh, they said no, Miss Beth. They said no. Let's let's go on to the next one. They said no.
They always teach you a no is actually an uncovered yes. They're just trying to see how much you're actually going to try to pull. But they're also trying to see, are you really listening to them, or are you listening for yourself?
Okay.
The best salesman, the best line I learned is listen till it hurts.
Okay.
So when someone tells you I'm not interested, so I'm not here to sell you anything. You came into the store, I was just trying to see how I can assist you. You know, really? Yeah. No. You know, I mean, we also have to be very perceptive as far as like, and we have, you know, it could be anything. You look at body language, and you know, the worst salesmen are those who just look at you as a dollar sign. Sales is not supposed to be a cheap date.
Okay.
Sales is about a nurturing relationship.
Okay.
If you're going to treat somebody like it's $1, they're going to feel like $1.
Okay.
But if you treat someone like you're really vested and interested in your, whether you make $1 or not, at some point in time, they're going to look at you and say, this person gets it, because they don't feel like that I have to buy something from them in order to have my time being considered as valuable. And And those are the ones that I guarantee will buy after that person year after year after year.
Okay.
Because not only they know them, they trust them, and they're treated with respect.
I'm going to date myself. I remember when I was little, the Kirby vacuum salesman would come by, and by the time he did his whole pitch, he would have had dinner with the family, been outside playing ball with all the kids. And, by that time, mom would have went ahead and made that investment, but he created that connection with the family before the check was even cut. So it's a whole process, but very interesting creatures. I just don't have the personality for it. And I'm like, oh, they said no. No.
I'll tell you, don't say no.
I gotta go and lick my wounds and put a band-aid on. They said no. I couldn't do it. I can't do it. It's not for
So
me.
funny. I love it.
I can't do it.
You're not dating yourself. Hey, look, I have a Kirby. I still have a Kirby.
Oh, really? I didn't even know they were still around.
Oh, yes, they are. I have one. My wife can't stand it.
Oh my gosh, I didn't even know. Yeah,
I'm looking at it right now because I'm the only one that uses it.
he would do the whole bowling ball thing and everything, and
Yeah.
I remember the whole dynamic of the Kirby salesman, and it was just he was there. He was committed for a couple of hours, and he had a meal by the time it was over. He had taught the kids how to play, football or baseball or whatever, but he had that whole check by the time it was done. So I still have the Kirby. Okay, all right.
You still work?
It still works. They make parts for it. I guess the thing never breaks, and it was just they don't make stuff like that anymore, right?
Yeah, my Kirby has to be going on 15 years old, and it still works.
Weighs 400 pounds, huh?
Now my wife won't touch it.
I don't blame her.
I'm using it.
All righty, so let me ask you my random question, and I'll get you on your way here. If you won $1 million, what would you buy first?
I can't buy time.
Mm-mm.
Okay, what I buy first? Interesting question. I would buy. Actually, I would buy my wife a new car because she just crashed it. She's okay. Yeah. This happened actually Monday. It's past Monday. It was a small. She loves the car. It's a Volvo C70 2006.
Oh yeah, okay.
And hardtop. Volvos are so extremely safe vehicles, and but yeah, I would buy her the car that she wants, and then set money aside for my kids. Let that money grow, pay off any kind of debt we have, and just let my wife splurge.
Fiscally responsible. Awesome. Yeah. Okay. I'm glad she's okay. And what did you do? We're taping this on Mother's Day. What did you do for Mother's Day?
So my wife did her own thing for Mother's Day. So she and my daughter took my mother-in-law out. They all had Mother's Day. My daughter's expecting next month.
Congratulations.
So
First grandbaby?
Grandbaby, I'm gonna be abuelito.
Abuelito.
So, yeah, grandma. And but yeah, so my mother-in-law and my wife, my queen, and my princess all had a good time. Awesome. Meanwhile, I was at church all day.
Busy church day.
Being a deacon and trustee is a lot. I have to count the finances, all that kind of stuff. And then I don't know where my time lapsed because came late to you, and I apologize.
That's all right. We're here now. We had some good time together. I am truly blessed with the information that you shared. Had a good time today. I thank you so much. I thank you for the work that you were doing. It's, you go into as a person of color, you go into a hospital, you go into a medical facility, and it's overwhelming just to be in the building, and to, interact with the staff, and you're not sure whether or not your needs are going to be addressed. Do you really want to listen to what I'm trying to explain to you? Um, just a case in point, I remember when I was pregnant with my daughter and I had dilated to 2 centimeters, and the doctor was like, go home, it's not time for you yet. And I was trying to tell my dad, they say it's not time. My dad drove all the way from Vegas to Los Angeles. That's like a 4-hour drive. And he was like, no, we're going to take you back and they're going to listen to you because these doctors, they have a habit of treating, because there's so much past history. So my dad, being an old Southern Black man, he was like, no, they're mistreating my daughter. And I was like, Dad, it's not time yet. But we have so much historical, trauma with medical facilities. So to see somebody doing the work to create an atmosphere, an environment where we can walk into and breathe and say, I'm going to be taken care of here. I know I'm going to be taken care of here. I know people have been put in place for my better good, to look out for my well-being, my health, my family's health and well-being. It's just a phenomenal thing. So I commend you on the work that you're doing. I commend you.
Well, thank you. I commend you on what you're doing and getting information out. That's extremely important. And you are a saleswoman.
I don't know. I tell you, you would just sit up there and shake your head if you looked at me and be like, there go Lana. They told her no, she didn't even try. As soon as the end comes out, I'm like, let me pack up my stuff. Okay, well,
Here's my
yes, that's all right. But anyways, thank you, dear. I wish you just continued blessings and favor, and all of that.
Thank you. You as well.
That is all for this week's episode of The Male Perspective. I'm your host, Lana Reid, and I will see you all next time.